Namaste. Myself, Dr. Soumya Ullanavar. I'm a Chief Consultant at Diabetes Reversal Clinic, Bangalore. So I'm over here today to address frequently asked question. Doctor, I use CGM machine because most of the patients are opting for an online reversal treatment programs. So I also happen to consult online. So their question is they're already using the CGM. So there are also few patients are also on the medications, few are on the insulin doses. So their concern is, depending on my CGM reading, can I skip my next medicine dose? Because when you say reversal, so whenever they consult me, I also tell them we generally taper the medications. So depending on the case, some individuals we can stop the medication. Some individuals I'll say they might need a supportive and Ayurveda medicine. Some individuals maybe if they have been recently diagnosed, they can also postpone their diabetes for the next 10 years if they are in a pre-diabetic stage. So it varies from an individual to individual. So they consider is Topricitol, for example, let's say 100 should be my FPS fasting, and I'm able to get it every time, maybe below 70. Then can I just skip my morning dose and I can stick on to afternoon and night? See, the first thing we have to understand, the CGM machine was being introduced majorly to help the insulin-based patients to take the insulin to decide their next dose of medicine. Only the CGM is being initially introduced. Then later it became as the technology developed, it became like a part of the diabetic patient's routine. Like how you carry your mobile phone, you will also carry that patch on your body. So basically everybody started feeling safe with it. So the patients, that's all the technology. We always feel safe when we wear this kind of watches or the digital gadgets. So we feel like, they keep us safe. They will let us know what's happening with our body. See, end of the day, whatever the gadgets you use and now the AI is so trendy, what I would say is you have to listen to your body, because the treatment doesn't come through the technology. Treatment comes through the science, and technology always supports the science, and definitely it has to grow together. So please understand, just because your CGM shows you the continuously for 3 or 4 days, your sugar levels are really down, doesn't mean you can skip your medicines forever. Maybe if you skip twice or thrice, it can suddenly shoot up also. That will also be shown by your same CGM machine, whatever you are wearing. So CGM is not the right criteria, I would say. That's not your doctor to decide on the dose of your medications. But in case of insulin patients, like the people who are already injecting the insulin and they already have a very fluctuating kind of values, and they are not able to understand how their body is responding if it is so much of unstable sugar levels, then yes, the CGM can help you to decide only your next insulin dose, but it cannot be used to stop your medication or just to skip the next dose of medication or completely get out of the medication. No, that is completely a wrong way of understanding the CGM. Thank you.